Good evening and welcome to Your Health Matters. I'm Tasila Tembo Peters. Today on the program, we continue looking at tuberculosis with a specific reference to tuberculosis in children. Diagnosing childhood TB poses its own challenges. Until recently, childhood TB has not been a priority in public health and has remained essentially a hidden pandemic. Health workers who care for children under the age of 15 are unable to recognize the signs and symptoms of TB in this age group. Where they suspect TB, the patients are usually unable to produce sputum. Where a child with active TB succeeds in providing a sample, it often contains no detectable bacteria. Let us now join Dr. Tamba, who gives us an insight of how serious the problem of tuberculosis is in children.
TB in children is actually very big. Right now, the problem we have is we do not have very clear statistics on the actual numbers. And so this country has undertaken a TB prevalence survey, which we are doing. We started conducting it this year. It will go on until next year. At that time, we'll be able to tell you exactly what the numbers are. But even without that, just a check through our major hospitals in this country, we know that most of the children who we classify as having respiratory infection or infections in the chest are actually suffering from TB. And so the problem is that when the children come, by the time they've come to our health facilities, they're so sick because we have been able to detect it while they're at home. Detecting TB is not as easy as it is in adults, because an adult, once they start coughing for more than 2 weeks, they start losing weight, we know that probably they're suffering from TB. But in a child, usually when they start coughing, we start thinking of the minor illnesses and we don't catch that TB quickly. Secondly, also when an adult is got chest TB, they will cough up and show the evidence of TB, which is blood in the sputum or in the saliva. But in children, it's rare that they will cough up blood. We have to actually get it out of them to know that this is actually TB. So it is a huge problem, and it's something that we are looking at to address.
How has the health sector responded to the problem of tuberculosis in children?
We have a very big program called Integrated Management of Childhood Illnesses, which focuses on just looking after children and how we can know that children have got an infection. So that program has also brought on board knowledge of health workers so that they can get to know quickly and identify those of children that are not just suffering from ordinary infections or chest infections. They can capture them early and take them to the hospitals. Apart from training, we're also training health workers. We're also training community health workers. These people work in the communities, and they're the ones who live with people in the community where the diseases are coming from. So these are also supposed to know what TB is, how to identify it, and also be able to guide people in the communities where they can go to seek help. And then another thing is, in the major hospitals or in the hospitals, we're able to then do the appropriate tests for children. Okay, that will be comfortable to get, or rather accessible to children, to be able to get the bags out of them and take them to the lab so that we can then test them and find out that it's TB. These are not very complicated tests, but they're not usually done. So we're making every effort for hospitals to make sure that they're able to diagnose TB at that level and be able to treat, then provide the treatment. In providing treatment, the government is making efforts to ensure that drugs for both adults and children are available.
All children who are in close contact with anyone suffering from tuberculosis should be provided with investigations. If you have any comments or questions regarding tuberculosis in children, do not hesitate to contact us. We are always delighted to hear from you.
Contact the producer, Your Health Matters, PO Box 30205, Lusaka, or email lacon.health@gmail.com.
That is all we had for you for today. I'm Tasila Tembo Peters saying good night and God bless.
Let us go.